I'm Jack Burns with the Mount Crescent Ski Patrol in the Rocky Mountain Division. This is Chapter 10, Shock. In this section, we are going to discuss two of our objectives, the 4 types of shock, and we will additionally cover the signs and symptoms of shock. In the section on anatomy and physiology, I talked about what can happen when we have any prolonged or serious disruption affecting any part of the cardiovascular system. It can result in decreased blood flow, cellular hypoxia, and hypoperfusion, or shock. So now we will categorize these cardiovascular disruptions into 4 types that center around the source of the disruption. So these source issues can be volume, or more accurately, blood volume, container, or relating to or dealing with the blood vessels, or pump, which are issues related to the heart. With that in mind, we categorize shock into the 4 types: hypovolemic, which is bleeding; cardiogenic, which are issues that affect the cardiac output, so those are pump issues; distributive, which are problems inciting vascular constriction, typically due to illness or infection; and obstructive, which can be container or pump-related issues where we have the vascular blockage or pressure on the heart affecting the cardiovascular pump. So let's look at each one of those in more detail. Hypovolemic shock can be hemorrhagic or non-hemorrhagic. The former is a patient that is losing a significant amount of blood, and the latter being the other external effects on the system, such as severe dehydration or burns. Cardiogenic shock is associated with heart-related issues that we should be familiar with and should know how to recognize during patient assessments. Distributive shock is when the blood vessels lose their ability to constrict properly. Distributive shock is subdivided into 3 subtypes: septic shock, anaphylactic shock, and neurogenic shock. Septic shock is caused by severe systemic infection, known as sepsis, and is the most common cause of distributive shock. White blood cells help to fight infection, and the immune system typically attacks and destroys pathogens. We will discuss this more in the chapter on allergies and anaphylaxis. Most infections can resolve quickly. However, if an infection progresses to sepsis, it can be life-threatening. A variety of reasons can affect an individual's ability to fight infection, including how resistant the body is to the pathogens, how virulent the pathogens are, how well the immune system is functioning, and the overall health of the patient. Medications can affect the immune system too. Unless sepsis is corrected, the pathogens will multiply beyond control, causing profound vasodilation and cellular hypoxia. Patients with septic shock may indicate that they are not feeling well or having flu-like symptoms. They may also have fever, body aches, or other feelings. Anaphylactic shock is caused by severe allergic reaction to some substance to which the exposed person is susceptible. Common causes are insect bites or stings, shellfish, nuts, or other foods or medications. Under normal conditions, the immune system releases chemicals that aid in the immune response. The body's response can lead to vasodilation and other problems. Without intervention, anaphylactic shock can quickly lead to respiratory arrest and death. Neurogenic shock is caused by disruption in the central nervous system, most often resulting from spinal cord injury. When damaged, normal signals to the blood vessels can be disrupted, causing the vessels to dilate. The patient can have a marked drop in blood pressure in this situation. It's important to note this process is not generally seen immediately after a spinal injury and usually can occur over hours and even days. We should probably not jump to the conclusion that a trauma with likely spinal injury is neurogenic shock, as most likely cause in a patient presenting low blood pressure and signs and symptoms of shock is hemorrhagic shock due to the blood loss. Obstructive shock results when some type of blockage is preventing oxygenated blood from reaching the vital organs. There is typically two causes of obstructive shock: external pressure on the heart or blockage within the arterial vasculature. And this is how we say obstructive shock is container-related or pump-related. The three most common causes of obstructive shock are tension pneumothorax, pericardial tamponade, and pulmonary embolism. We will explore each of these in the chapter on thoracic injuries, but let's briefly look at each now. Tension pneumothorax is air in the pleural cavity, and if that air cannot escape, pressure can build on the pleural space, compressing in on the heart and affecting its ability to pump effectively, which we intuitively can assume causes a drop in blood pressure and shock. Pericardial tamponade is when fluid collects in the pericardium, the sac surrounding the heart. The result is the right side of the heart that pumps blood to the lungs can collapse, decreasing cardiac output and leading to the shock condition. The right side of the heart is more vulnerable to such pressure because of the walls on the right side of the heart are thinner than the left. Sources for blood in the pericardium include blood from penetrating chest trauma and other medical conditions. And then finally, pulmonary embolism can occur when a blood clot in the pulmonary artery becomes stuck. This resulting disruption of blood flow to the lungs prevents the necessary gas exchange in the cardiovascular system. This is a serious and potentially fatal condition if not treated immediately. In the next video, we will review the 4 types of shock and build a handy matrix for the signs and symptoms of the 4 types of shock.